The first doses of the Pfizer vaccine for kids aged 12 to 15 were given yesterday in Georgia, Delaware, and Arkansas, a day after the FDA approved the vaccine for that age group. Those states' public health systems decided not to wait for the final approval from the CDC's Vaccine Advisory Committee, a decision that could come as early as today. Right now, it's an emergency use authorization. Public health officials in Georgia say they were worried that if they turned away young people who wanted the shot yesterday, those kids might not come back. More than a dozen states, including New York, Minnesota, and Texas, say they will wait for the go-ahead from the committee, and they're ready as soon as that approval comes down. The committee will be meeting today. States could begin vaccinating children as soon as Wednesday and Thursday. Joining us now, practicing internist, healthcare educator, and mental health advocate, Dr. Lucy McBride. Dr. McBride, it's great to see you again this morning. Let me begin with the childhood vaccine. Should parents be confident now in giving this to kids aged 12 to 15?
I think, well, first of all, thanks, Willie, for having me this morning. It's great to be here again. So I will have my 15-year-old daughter vaccinated because she wants it. She, like all of us, has been marinating in fear for 14 months, and this will help her go to camp, go to school, engage in social activities without fear. That said, I think this should be a parent-by-parent, guardian-by-guardian decision because there's no one-size-fits-all prescription for how to handle the vaccine for this age group. We know that this age group is at very low risk for COVID-19, yet vaccinating them offers a public service and hastens the containment of the virus so that we can get on with our lives.
So there are questions about the vaccine, which now, as I say, will be available this week, 12 to 15, but also about masking. You've got a new piece in The Atlantic titled, "Why I Don't Think Kids Need Masks Outside." Dr. McBride writes this: as parents gradually reap the rewards of vaccination, they're wondering if they need to keep up pandemic precautions for their children's sake. Although emergency use authorization for the Pfizer vaccine was granted this week for 12 to 15-year-olds, kids this age and under don't need to wait for freedom through shots. They can and should enjoy some benefits of our collective progress. That's why I've begun telling my patients that their kids, vaccinated or not, do not need to wear masks outside. The big picture is that we're entering a new phase of the pandemic. As more than half of adults in the United States have received at least one vaccine dose and case rates drop, the risk of transmitting COVID-19 to unvaccinated people also lowers. Unmasking kids outside, getting them moving, and reconnecting them with their friends is the evidence-based path toward restoring their health and their well-being. Dr. McBride, as you know, as I know with kids, they've been in these masks for over a year now. Why do you believe, I'll let you flesh this out a little bit, it's okay for them to start taking them off, at least outside?
Well, let's talk about the facts. The fact of the matter, Willie, is that outdoor transmission is exceedingly unlikely. There's actually no documented case of outdoor transmission of SARS-CoV-2. From casual interactions outside, like passing by someone on the sidewalk or at an outdoor restaurant. It just hasn't been documented. In fact, if you talk to most epidemiologists and public health officials, it's thought to be, far less than 1%. And when the advantages, the social emotional benefits are so huge, letting kids engage in their lives, letting them see the full range of facial expressions of their peers, when those outweigh the minuscule risk of outdoor transmission, it's really time to put facts in the driver's seat of our behaviors and public policies and take fear out of the driver's seat. We need to stop exposing kids to unnecessary fear and an exaggerated risk of outdoor transmission because, after all, health is more than the absence of disease. It's about not getting sick. And of course, there will be parents who want to mask their kids outside. There are high-risk children. There are children who live with high-risk adults. But in general, for most children, anyone who's outdoors, the risks of outdoor transmission are so small, and the benefits of moving on in an evidence-based way are enormously high.
Yeah.
Hey, thanks so much for watching our YouTube channel. You can follow up on today's top stories and breaking news or catch up on your favorite MSNBC shows all in one place. Download the NBC News app today.